am Tom Brunner. I'm one of the nurse practitioners in the pediatric hematology and oncology clinic. I've been here for about 7 years now. It's a nice return home. I was actually the nurse practitioner for the sickle cell program with Pete back in the early 2000s. And so it's been fun seeing some of the sickle cell patients that I took care of when they were like 2 and 3 years old, who are now seniors in high school. It's an intense job, but I love it. I love working with the families. I feel like my role is to make a difference when the kids are there. I try to be a bright face in what can be a very chaotic clinic visit. It's interesting, we had one kid recently who I was celebrating the fact that it was his last spinal tap. He was like, oh, that makes me a little bit sad, because every time we go up, we have a staring contest as they're giving him the propofol and he's going to sleep, and so we try to stare and see who can keep his eyes open the longest, and he always manages to win. You would think that these children who are coming in weekly and sometimes multiple times per week for chemotherapy, for lab draws, for blood transfusions, that they would be miserable. And clinic is not a miserable place. The kids are usually smiling. They love going to the treasure box every time. I get lots of hugs. You know, how many jobs do you get to go to where you get sweet little 4-year-olds literally running up and giving you a big hug when they see you in clinic. So that's one of the big things that keeps me coming back also. It's just the relationships with the kids and the parents. But it is nice to have that much continuity and develop these kinds of relationships with the kids and the families over years. So that's one of the things that I really was looking for when I was trying to figure out what I wanted to do as a nurse practitioner. Last week, it was Ask Day at the Dime in support of Childhood Cancer Awareness Month. And there were kids that I hadn't seen in years, again, that came up and remembered me and taking pictures and things. Again, now that they're 4 or 5 years out of treatment, looking amazing, doing well, doing great in school. So a lot of things like that are really special. There's also an Ask graduation that they sponsor, and a couple years ago, my very first pediatric cancer patient that I was her primary nurse, like, I don't know, 4 or 6 months out of nursing school. But I was her primary nurse, and she was probably 3 or 4 at the time. Took care of her for a couple of years whenever she would come in, and she asked me to come to the graduation ceremony, and she is finishing up her degree now at Clemson, which is just amazing to see how well she's done and how far she's come. And so that's been really special. Cake versus pie. I think in general I'm a cake person. Chocolate cake with white icing maybe. But my favorite dessert in all of Richmond is the oatmeal cream pie from Shindig's, which is neither cake nor pie because it's kind of a cookie. So it is, if you haven't had it, it is amazing oatmeal cream pie at Shindig's.